This is a rapid assessment for Carrie Filippetti. So I am dispatched for an injured person from a fall. The first thing I do when we arrive on scene is confirm scene safety. So the scene is safe. I have on my BSI and I see a single patient lying supine next to a ladder. He's cradling his arms near his left rib cage. So at this point, no additional resources are immediately evident for scene safety. But given the ladder and the dispatch, I'm going to bring necessary equipment for C-spine stabilization. So at this point, I consider it maybe a priority 2 patient, but there's a little bit more information that we're going to need to know. So as I approach, the patient calls out to me. I introduce myself. I'm EMT Filippetti. Please try not to move. I'm going to have my partner provide stabilization for your neck because I'm worried you might have a spinal injury. So at this point, my partner will come over and provide C-spine stabilization through the duration of this assessment until we get him onto a backboard. I learned from the patient that he fell approximately 15 feet from a ladder and is in severe pain from his left side. He is alert and oriented. He seems to be responding appropriately. He is indicating exactly what has happened. It shows to me that he has a patent airway. His breathing does appear a bit labored, but what I'm most concerned about is the fact that there's a lot of uncontrolled bleeding coming from his wound, and also that this is not a stable impaled object. So I see that this object has punctured his left rib, and so before I do anything further, I'm going to call for ALS. I don't know exactly what it's injured, but I know that it could have internal bleeding. So I make the call for ALS, and then my major priority is to control the bleeding. So first I control the bleeding with dry dressing, and then what I'll do is I'll stabilize the impaled object using trauma dressing, cravats, and then I'll put a plastic container over the object to make sure that it doesn't move at all during transport. And obviously throughout all of this, my partner is going to continue to hold C-spine. Now with the bleeding controlled, I reassess my ABCs. His breathing is still labored, so I'm going to provide oxygen at this point via a bag valve mask. I don't want to use positive pressure because it's possible that this has punctured the rib, and in that case, if it's gone into the lung, then that could exacerbate a possible future pneumothorax. At this stage, I'm going to move to my rapid assessment to make sure that because he fell from the ladder, there's not some additional injury that this is distracting from. So to do that, I'm going to start from the head, and I'm going to do a rapid assessment checking for decap BTLS at all parts of first the head, the neck, and shoulders. Then I'm going to move over to the chest, of course making sure that I'm speaking to the patient and seeing if he's feeling any pain in any of these areas while I'm checking. I'm going to avoid this quadrant because I've covered it with bandages, but I'm going to check his pelvic area. I'm going to do a flyby to check for preabism because there is a possibility of a spinal injury. Again, assess all the way down through the legs. He seems to not experience any problems. He's noting that he's feeling everything. He knows which toes I'm touching on both sides. He can wiggle his toes when I ask him to. I come back up and check his upper extremities. Those all look good as well. And while I was doing this at the chest area, I also did take a second to check for lung sounds. Again, trying to make sure that there was no issue with the breathing, and in this case they were clear and even. At this point, I'm going to do a full log roll with my partner, check his back the whole way down. Again, everything looks fine. He's being responsive to everything. We're going to put the backboard under him, roll him over it, attach him to the backboard. And since this is, at this point, we're monitoring his vital signs, this is where I start to get a little bit nervous. I notice that his heart rate is 120 beats per minute. It's pretty weak and rapid. He's got shallow breathing and his blood pressure is about 108/58. And so in speaking to the patient, I notice that he's starting to get a little bit agitated and also a bit confused, which is different from where we were before. So we already have him on the backboard. That's great because he's now become a priority 1 patient. I'm starting to get really concerned that he's entering shock. So we will immediately transport him. We'll lift him on the backboard into the cot and into the ambulance, transport him as priority 1. We already have the oxygen on him, so we're just going to make sure that we continue to monitor that during transport. And then that's it. Thank you very much.